From bilateral talks to Health Watch, doctors in the country are threatening to withdraw their services starting May 9th should the government fail to address what they have termed as the declining healthcare system and failure by the Ministry of Health to post medical interns. Meanwhile, health workers, including clinicians, UHC staff and laboratory technicians, also joined the doctors in demanding that the government resolves inefficiencies associated with Social Health Authority platform. And as Joseph Wakhungu reports, the Senate has vowed to urgently address the health workers' complaints.
For the better part of Tuesday, medics and intern doctors took to the streets of Nairobi in agitation for better working conditions. Led by the Kenya Medical Practitioners and Dentists Union Secretary General Dr. Dav Jetela, the medics marched from Kenyatta National Hospital to Social Health Authority offices in demand for the streamlining of services offered by the health insurance scheme.
We have more doctors that the doctor said from Kiambu, who has been having stage 4 lung cancer. This doctor has been faithfully managed by NHIF. But from October, this doctor has been paying out of pocket to get care. We have another doctor again who is currently admitted in ICU in KNH. This doctor was to be discharged for home-based care. But again, we have to do another contributions. So yeah, we keep on wondering, who is SHA covering? That is our biggest concern. Who is it?
The health workers, who also presented their petition at the Ministry of Health, lamented over the delayed posting of intern doctors while threatening to down their tools in May should the matter remain unresolved. Claims of the government refusal to absorb on permanent and pensionable terms over 8,000 medics, including clinical officers and laboratory technicians who were in 2020 employed under the universal health coverage, also took center stage.
For avoidance of doubt, because there are people who are saying that the strike of the UHC was called off. The UHC strike for clinic officers under the UHC program was not called off, and they are still on strike. And they should not be victimized because they are exercising their rights under Article 41 of the Constitution as well as the Labor Relations Act.
Speaking after receiving their petition at Parliament buildings, Senate Deputy Speaker Kathure Murungi vowed that the Senate will have their issues expedited in order to forestall the disruption of medical services. His sentiments were echoed by Nairobi Senator Edwin Sifuna.
We shall handle this petition for you, na sisi ndio tumejitolea tukaambiwa na speaker tukuja tuchukue. So I mean you should really believe that hii kitu iko kwa mikono sawa sawa, si ndio? Now we shall make sure whatever it takes to make sure that all these matters have been addressed by the Senate.
Once again, these health practitioners have taken to the streets of Nairobi, asking the government to prioritize their calls to ensure that they are able to offer better health services to Kenyans seeking medical services in health centers across the country. Reporting for KBC Channel 1 News, my name is Joseph Wakhungu.